Thank you all for coming. This is going to be a theater in the round or a theater in the rectangular, where we're going to be, in some ways, culling or pulling together some of the concepts that you've heard regarding the meeting by doing a workshop where we'll be actually doing some role play, and you'll see how some of these things get played out. I'm Doug Drossman, and I'm pleased to be working on this. This has been a remarkable experience for us, just getting this going. I want to introduce my co-moderator is Ben Sapol, who's artistic director of Theater Delta, which is an interactive theater based in Chapel Hill that promotes social change in communities nationally and internationally, and he has an interest in doctor-patient communication, a special area of his focus. He's also now a visiting professor of theater at Loyola University. I got to know Ben about 2 years ago when I found out about his interactive theater, and he came to our evening workshop where we do role plays and videos, and we formed a kind of a team and was fortunate to get a grant from a pharmaceutical company to do these kinds of programs at the university. So Ben will be moderating with me. The goals of this session is to highlight the cultural differences in communication in the medical setting, just as in a doctor-patient visit. And then we'll try to apply strategies that will give us a more effective interaction that's consistent with the patient's explanatory model or illness schema. And that will be, I think, again, a culmination of what we heard. Now, fortunately, a lot of work was put into additional materials for you on your memory key. Does everybody have a memory key? Anybody not? Okay. In your memory key, we have the whole program here. We have the summary of the program. You will receive at the end, and you have in your handout a comparison chart of the different countries that we're going to be focusing on, the 3 different countries. There's extensive information on the cultural aspects of the illness communication in the Nigerian, Mexican, Russian, and Chinese. Now, unfortunately, because of the sake of time, and we didn't have an actor, we're going to be doing Nigerian, Mexican, Russian, but there's extensive information by Dr. Kiwin Sia from Singapore, who did the Chinese patient case. And I do have a video in there too, Cecile? Is the video in there or not? Okay. And then there's a commentary on sociocultural factors in medicine that Steve Weiland and I had done as an editorial. So let me also introduce who's going to be doing this with us, the actors, so to speak. Lynn Chang, who I think you all know, is professor of medicine at UCLA. She is co-director and head of the clinical program of the Center of Neurobiology of Stress at the David Geffen School of Medicine. Her interests include pathophysiology of IBS, specifically in the areas of IBS related to stress, sex differences, and neuroendocrine alterations. She's a member of the Rome Foundation Board of Directors and is president of the newly emerged ANMS FBG. Also, Lynn will be playing the doctor. In terms of the patients, Dr. Demola Aderaju, who's at UNC, he's a research fellow in functional GI and motility disorders, will be starting his clinical fellowship starting in July. He's been interested in cross-cultural differences and is doing a study now looking at differences between Africans, African-American in Nigeria, African-Americans, and Caucasians in terms of functional bowel. The person who will be playing the Mexican woman is Dr. Carolina Olano, who's Associate Professor of Gastroenterology at the Universidad de la República, Montevideo, Uruguay. She is past president of the Uruguayan Society of Gastroenterology. She was part of the IBS Guidelines Task Force of the WGO, and she's very interested in GI education and has a master's degree in education as well. Next, for the Russian woman, is Dr. Halpert, assistant professor in the section of gastroenterology at Boston University School of Medicine. Her clinical and research interests include the management of functional GI and motility disorders such as IBS, dyspepsia, constipation, and fecal incontinence. Other areas of interest include antidepressant treatment in IBS, patient education, and the patient-physician relationship. But they're really good actors, too. And I won't introduce myself. Okay. So the way the format is going to run is we have 3 cases, as I mentioned. There will be a case presentation which I will give, which will be the generic case. And then what you will hear is relatively the same history that will be manifest based on the cultural context of the 3 different groups. We will then have Dr. Sapol will run a facilitated discussion of what you saw as being relevant. Then there will be some time where you'll be making suggestions of how that clinician could do it differently to make it better within the context of the patient's illness schema or explanatory model. And then we'll replay the video based on your suggestions, and we'll be taking our notes up there. We'll do that 3 times, and in the end, we'll summarize things.